Hey, what's going on, guys, and welcome back to another video. I think this one's going to be pretty short and sweet, but I think it is a very important lesson because it's something that I think frequently folks forget, and that question we'll be answering today is pediatric endotracheal tube sizing. Specifically, if I have a sick kid who comes into the emergency department, what size of an ET tube do I need to pick? So one of the important things to know when it comes to endotracheal tubes with pediatric patients is that there's two types of ET tubes that you can use. And I've written them out here, right? So you have cuffed and uncuffed. Now, for the sake of this lecture, I think, and in practice, it is much more important that you understand the size of the cuffed endotracheal tube. All right. So let's go ahead and get started on our formula. So first, let's go ahead and write out the formula for the uncuffed ET tube. So there you have it. There is your uncuffed ET tube formula, age in years, divided by 4 plus 4. Now, another important thing here is that I'll show you the difference between the two different ET tube sizing formulas, but this is going to be the most important one, and I'll explain why in a second. Now, let's go ahead and get into the cuffed ET tube sizing. All right, now, as you can notice here, it's essentially the same formula, except a general rule of thumb is that for the cuffed ET tube, you're going to subtract half from that uncuffed size. Now, generally, I've been told by peds ED attendings that it's not necessarily the end of the world if you use a cuffed ET tube at the uncuffed size range. And a lot of the times in these situations, it's very stressful. And it's just easier to remember age divided by 4 plus 4. All right, now let's go ahead and move on. Here's one kind of component that I think is important when you're intubating a pediatric patient. And that is, how far do I insert the tube? And there's also a very simple formula for this. And it's simply 3 times the tube size equals the depth of insertion. All right, and there you have it. 3 times tube size equals depth of insertion. Very briefly, let's go ahead and do a quick example. Now, say you have a 4-year-old male who's coming into the emergency department in respiratory distress, starting in, say, the low 80s, 70s, and you're trying to bag them up. They're not protecting their airway, and you decide to intubate. So let's go ahead and discuss what size ET tube one would use. Now, just for the sake of being thorough, we'll go through cuffed and uncuffed, even though in this scenario, the cuffed ET tube would be the one you'd use. So let's go ahead and get started. I'll give you a second here to think about your formula, and using the age 4 is going to make it a lot easier. But remember, it's going to be age divided by 4 plus 4. So in this case, it'll be 1 plus 4. In this instance, for uncuffed, you'll be looking at a 5.0 ET tube. And let's say you want to do cuffed. Just remember that it's minus 0.5. So you're looking at a 4.5 ET tube. Now let's think about depth of insertion. So remember, it's going to be 3 times the tube size equals your depth of insertion. So say we use that 5.0 ET tube. And then for that cuffed, you'll be 4.5 times 3. Just to be thorough, the insertion depth is going to be in centimeters. And then the ET tube size is going to be in millimeters. Well, that's all I have for you guys today. I hope this was helpful in just referring to endotracheal tube sizes. As always, if you have any questions, feel free to shoot me a message, leave me a comment, like, comment, subscribe, and I'll see you guys next time.